Thank you for staying with us on Channels Television. Welcome to Health Matters. I'm Yomi Otaigwe. Today we'll be having a discussion on a condition that affects or that could affect the joints in the body, and that's arthritis. And I have with me in the studio a consultant, orthopedic and trauma surgeon, Dr. Charles Uzodimma. Thank you for joining us.
Thank you too for inviting me.
Okay, arthritis. I've heard so much about arthritis that sometimes I wonder, what it really is all about. So let's just set the stage. What is arthritis?
Arthritis means when the joint is sick. Once the joint is sick, it means arthritis. In the body we have we have 206 bones. And all these bones, wherever 2 or 3 meet together, they'll form a joint. And any of these joints, once they are sick, it means arthritis. That is the simplest
explanation you can give for now.
Anything you get beyond that will begin to involve some of our strong-worded terminologies. But, just arthritis, Greek word, the joint being sick. But the thing is that once it's sick, there are things that it will show to show that it's sick.
Okay, and one would wonder that this joint and every part of the body is supposed to last the individual a lifetime. So what happens? Why would it become sick?
Yeah, I like that you said, because actually this is part of the problem we have in medical or health sector in this our society. It is seen as if sickness or illness is not part of the living. Once somebody is alive, there is bound to be some illness or sickness. This is now the whole body, because while functioning, once there is slight deviation from the normal function, or there is something extra that comes to interrupt the way the body or any part of the body functions, there will be sickness or illness. So what you are saying, that you thought that it could outlive someone, he hasn't said that the joint is not outliving someone in lifetime, but he is bound to be ill from time to time, depending on what will cause it. That you just take, for instance, the skin that you see. My skin as it is now is not the same as when I was younger. Even this change as I'm getting older could go in at a rate which could show that my skin is sick. Same happens to our joints. And the sickness of the joint, it does not even spare any age. It can occur in the children, it can occur in young adults, it can occur in the elderly, depending on what will cause each at any time.
Okay, so what are those things that could cause it?
Yeah, if we go more according to ages, in the children, in younger age, well, growing child, the common causes or commoner causes in that condition is infection. That is germ entering into this joint. In fact, usually so amazing and so deceitful that when it happens, the caregiver or the parents or the guardian will only just come to tell us that the child fell down. They never saw when he fell down, because even the child also will come and report that he has fallen down to injure that joint. Because from time to time, children fall down, but this joint will just suddenly begin to manifest as if there is injury, because there is going to be, and that infection that could have been in that joint comes in different ways. It can be either directly that something punctured the joint to give allow germs to enter into the joint, or it could be that a germ also growing on skin at a part away from the skin will come also into the joint, or that a child that is just coughing, having germ in the airway. Once that germ is in the blood, when it gets around the child's joint, because of the peculiarity of how the blood supply in the joint is, the germs could then accumulate there and cause these conditions. So when you move away from this the children, come to young adults, it becomes more of injuries. Because once the joint is injured, it will also turn to be sick. You will now have the one that will be traumatic arthritis. And also in that situation too, you can still have that one of germs, that is one that is from infection. Because at that time too, things can be put into the joint, either by giving injection or injuries directly there. When one gets older, the one that in very commonly people will call it rheumatism. In my village, they will say somebody has rheumatism, because when people are getting older, the joints will begin to pain them. That one when it is found more in those who have stopped growing and as they get older, because in that one, the covering of the joint, the bone ends as the joint. That is the cartilage, the biscuit bone. If you have eaten chicken joints before, when you're eating chicken legs or goat leg, you see that at the joint there is whitish covering of the bones. That whitish covering, as we get older, it naturally begins to dry up, weaken. Once that happens, body will begin to react, attempting to repair, but this biscuit bone doesn't have power to regenerate very well.
Itself. And as you said, it could affect any part of anywhere there is joint in the body. And we have this picture on the screen showing the spine, showing the knee, the foot, hand, and hip.
Yes.
So talk us through this.
Yeah, just as I said, not all of them are not only spared. Then the sites, the joints that are affected, depends on at the age or what type of that arthritis that is going on. If it's the one of when people are getting older, the one that is actually the commonness of the joint being sick, the one we call osteoarthritis. I don't like using all these big things. Important thing is to understand that joint is sick because people are getting, because the covering is weakening as age progresses, not in old age. That one in female, he attempts to, it goes more to affect the knee, and also in blacks. But when you go to white, it affects the hip more, but it can also affect all the joints. Any joint that has all the things that are predisposed to it, because there are some factors or activities that will make this condition to occur faster or more intense in an individual. Example is, as I said now, when someone is as you're a female, there are some you suffer more than I would do. It's just natural. And also when we overweight, when we are obese, my weight now is overweight. I'm prepared. If I keep on keeping this weight, I'm predisposing all my joints, hip joint, a knee joint, my ankle joint. I'm predisposing them to overweight bearing as they bear my weight. So effectively, that will predispose it to that coming faster.
So also, being overweight.
Yeah.
Okay.
So even overuse of these joints, for those who do anything that involve overuse of the joints, trekking, manual work, those who work in place where machine vibrate because when it's vibrating, it's a joint that move more than other parts of the body. This also will predispose people to have it more. Then even injury to any joint. I don't know if you have sustained any of those your female common injuries, injuries of high heel, the one that your ankle will do swag and eventually had some ankle sprain or strain, whichever. And you will just have some pain a few days and either treated properly or most time not giving attention and it settles on its own. That eventually will sentence the joint to a faster.
Okay, now we see this picture.